And now we have Robert Cruz, who's going to talk about an analysis of a provider survey, which many here in this room participated in, looking at prevention services for men who have sex with men. Okay.
Thank you, Leif. Good morning, everyone. As Chris just mentioned, last fall I was charged by the Department of Public Health to conduct a provider survey on HIV, STI services for MSM in Connecticut. The Department of Public Health AIDS and Chronic Disease Section initiative is to respond to the significant higher incidence of HIV, STI infections among men who have sex with men, as well as significant numbers of co-infections, and to respond to the need for more prevention interventions directly targeting MSM. The goals of this assessment were to conduct an analysis among providers, focusing on perceived prevention needs, barriers, successes, challenges, and perceptions of capacity related to providing HIV prevention services to MSM in Connecticut, and to identify capacity building, assistance, and training needs of providers to help ensure more HIV prevention services for MSM in Connecticut in the future. The design of the survey and analysis was as follows. Interviews were held with 16 providers across the state of Connecticut who provided their professional opinions about MSM HIV STI prevention topics. 16 providers across the state of Connecticut. 13 of these were M.P.H-funded HIV prevention contractors. 2 were healthcare providers that specialize in HIV care, and 1 was an academic research institution. Frequency analysis were conducted. There were 19 open-ended questions. The top 3 answers were reported. Most of the questions allowed for multiple answers, and some of the questions were designed for agencies, providers, or contractors, and not applicable for a physician or a research entity. So here are some of the analysis findings. In respect to HIV STI prevention needs for MSM, the majority of respondents indicated that young MSM population should be the top priority, followed by risk reduction and more awareness of STIs. Differences in ethnic and cultural needs, clients' fear of rejection, stigma, and no one message fits all MSM were reported the most as barriers to providing MSM disease prevention services. When it comes to interventions considered as not being successful, poorly crafted message, one-size-fits-all approach, and limitations around the design of the interventions were considered the most significant, inadequate approaches by respondents. Lack of LGBT community leadership, poor outreach job done locally, and the difficulty of reaching the MSM community were the top responses considered to be challenges of providing HIV STI prevention services to MSM. In the area of having the ideal capacity for the implementation of execution of HIV STI prevention services for MSM, respondents indicated that funds was a major factor, recruitment of volunteers, and the addition of more staff as their top needs. In regards to increasing the capacity at a statewide level, respondents considered that a mass campaign, workshops among providers, and the state working closer with providers were the most important areas to be targeted. As far as the HIV STI prevention services that respondents would like to offer to the MSM in their respective communities, community outreach, risk reduction, and basic outreach were the top 3 answers. Trends experienced by MSM in Connecticut, reported as being priorities by providers, were the risk of using internet websites for hookups, followed by the risk associated with the use of recreational drugs at parties, and a young MSM STI diagnosis pattern, as we heard earlier. It was recommended by providers the need of a change in perceptions by the MSM community, reporting as equally important in 3 areas: increasing the self-esteem of MSM, that STI can happen to anyone, and educating MSM about safe sex being an option. This assessment concluded a need for a more cohesive approach where agencies around the state come together and exchange ideas, a need for capacity building assistance, training for providers on the issues related to providing HIV, STI prevention services to MSM, a need for new strategies to reach MSM with prevention messages, including the use of technological innovations such as the internet and cell phone applications, and the need to address cultural, racial, ethnic, and social challenges of providing HIV, STI prevention services to MSM. This assessment contributes significantly to understanding the MSM Gear HIV, STI prevention services barriers and needs in the state of Connecticut and provides a foundation for future recommendations of effective interventions for MSM in Connecticut. Muchas gracias.